Introduction: Electricity and magnetism. What is electricity? Electricity is the movement of electron between 2 points, which create an electric current. It is a type of energy that is used to power home, business, and appliance. Magnetism. Magnetism is a fascinating invisible forces. It influences the environment around it. A magnet is a material that can pull certain type of metal toward itself. Unlike many other forces, magnetism doesn't have to touch the object it affects. Gravity is also an invisible force that act as a distance. What is MRI? MRI stands for magnetic resonance imaging, a non-invasive medical imaging technique that uses radio wave and a powerful magnet to generate detailed image of the inside of the body. MRI are used for a variety of purposes, including diagnosing disease, planning treatment, monitoring treatment progress, imaging the brain, spinal cord, heart, blood vessel, bone, joint, soft tissue, organ, and breast. Concept of electricity and magnetism in MRI machine. MRI machine is based on the idea that a strong magnetic field can force proton in the body to align with that field. The MRI machine then send radio wave to temporarily knock the proton out of alignment. And when the radio waves are turned off, the proton realign and send back radio signal. The MRI machine uses this signal to create digital image of the body. Strength of the magnetic field. The strength of the magnetic field is measured in Tesla T or Gauss T. The static field strength of most MRI machine is about 1.5 to 2.0 Tesla. Creating the magnetic field. An electric current is passed through coil of wire to create a strong magnetic field. The magnet is cooled with liquid helium to create superconductivity, which allows the coil to carry more current and produce a stronger magnetic field. Stimulating proton, a radio frequency RF current is passed through the patient, stimulating the proton in their body and causing them to spin out of equilibrium.
Machine's resonance imaging MRI consists of four main compartments. The first one, main magnet, that are using superconducting magnet that has many coils wire through which current flows through it. It also can create a magnetic field up to 2.0 Tesla. Next one is radio frequency coils, RF coils. It is almost like an antenna for MRI system that broadcasting signal to the patient and or receiving the written signal. The third one is computer system. The function of computer system is to monitor the patient's heart rate, respiration, and blood oxygen levels. It also ensures the patient's safety and allows technologies to make adjustment when necessary. Last one is gradient loops. Gradient loops is loops of wire or thin conductive sheets on cylindrical shell in MRI. The main function of gradient loops is to allow spatial encoding of MRI signals. How does MRI works? MRI works when the strong magnetic field created by the MRI scanner causes the atoms in our body to align in the same direction. Then, radio waves are sent from the MRI machines and moves all the atoms out of its original position. It is later that the radio waves turn off and the atom returns to its original state and sending back the radio signals. At last, the signal will be converted into an image of a part of the body that was examined when the computer received it, and the image will appear on computer screen.
Let's explore the real-world example of how MRI technology works in physics is applied in healthcare. Case study example is a 60-year-old man is rushed to the emergency room with symptoms of slurred speech, facial dropping, and weakness in his right arm, all pointing to a possible stroke. An MRI scan is performed immediately. This involves using strong magnetic fields and radio wave to visualize the brain internal structure. A specific type of MRI called diffusion wave imaging or DWI detects area of reduced blood flow. By measuring how water molecules move in brain tissue, the MRI can identify the stroke type, whether it's ischemic caused by a blood clot or hemorrhagic caused by bleeding. This distinction is critical because it determines the appropriate treatment. For instance, in an ischemic stroke, doctor might use a clot-dissolving drug to restore blood flow. This example highlights the incredible role of MRI, where principles of physics such as magnetic resonance and water diffusion directly save life. Beyond stroke, MRI is also used in oncology to detect tumors, in sport medicine for ligament injuries, and in neurology for conditions like multiple sclerosis. Now, let's focus on the benefits of MRI machines from a physics perspective. First, MRI is a non-invasive and safe diagnostic tool. It relies on magnetic fields and radio wave, avoiding harmful ionizing radiation. This makes it suitable for a wide range of patients, including children and pregnant women, ensuring a safe and painless experience. Second, the physics of MRI allows for high-resolution imaging. The magnetic fields align hydrogen atoms in the body, and radio wave perturb this alignment. When the atoms return to their original state, they emit signals that the machine converts into detailed image. This precision makes MRI ideal for detecting soft tissue structure like brain tumors, spinal cord injuries, and joint tissue. Lastly, the versatility of MRI stems from its ability to adapt its setting based on the type of tissue being examined. Whether it's identifying abnormalities in the brain, monitoring cancers, or assessing ligament tears, the underlying physics principles ensure MRI remains one of the most valuable tools in modern medicine.
Last but not least, here are the future development and innovation on MRI scan. The first one is faster scanning times. Advanced technologies like compressed sensing, parallel imaging, and AI-driven reconstruction methods are enabling faster scans, reducing the times patient needs to spend in the MRI machine and improving throughout all healthcare orders. The second one is high-resolution image. MRI machines are moving toward higher magnetic field strengths, which improve resolution and signal-to-noise ratio. This allows for more detailed image of tissue, including the brain and organs, and may help detect subtle abnormalities earlier. The third one is increased accessibility. Manufacturers are exploring ways to reduce the overall cost of MRI system. One approach is through simplified designs using a lower cost component or engineering innovation that reduce the need for expensive infrastructures. This could lower the price of machines, making MRI scan more affordable for hospitals, especially in lower source settings. The fourth one is multimodality imaging. AI is poised to play a key role in interpreting multimodality imaging. By analyzing data from different imaging sources, AI algorithm can enhance the function process, automate image registration, and assist clinicians in making more accurate diagnosis. The last one is artificial intelligence and machine learning. AI algorithm can assist radiologists in interpreting MRI scan more quickly and accurately. AI is expected to help with automating image analysis, detecting abnormalities like tumors, and even predicting the progression of disease such as cancer or MS. The conclusion of medical application. The medical application of magnetic resonance imaging has revolutionized diagnosis and therapeutic practice. As a non-invasive imaging technology, MRI provides highly detailed image of soft tissue, organs, and structure within the body, enabling
earlier and accurate diagnosis of conditions such as tumors, neurological disorders, musculoskeletal injuries, and cardiovascular disease. Its ability to differentiate between various tissue types without ionizing radiation ensures safer diagnosis procedure for patients. MRI has also advanced treatment planning by offering precise visualization for surgeries, radiation therapy, and intervention. With continued technological advancement such as functional MRI, which is fMRI, for brain wave mapping and contrast enhanced imaging. The scope of MRI application is expanding further. Overall, MRIs remain an indispensable tool in modern medicine, significantly enhancing patient outcome and advancing clinical research.